Many hearing therapists are not familiar with the existence of interpreters in the lives of deaf people. They aren't aware of our place in the context of deaf culture. We are cultural artifacts just like TTYs, flashlights, residential schools, and other emblems of the deaf community. Interpreters should act as cultural informants to the therapists they work with. For this reason, we must be sure we are prepared to speak intelligently about the linguistic and cultural issues at work in the therapist's office. It is not acceptable to kinda know a little something about the structure of ASL or about significant aspects of growing up deaf. We have a reputation for saying we know a lot when we know very little. For this reason, I use a lot of caution when I say we should be cultural informants. Thus, it is only natural that there should be a reaction to an interpreter, any interpreter, in a therapeutic setting. It is in the best interest of the therapist to explore the client's feelings about the presence of the interpreter, not to avoid the discussion. The interpreter, communication issues, all of these things should be discussed during therapy with the interpreter interpreting the discussion. This allows the client to express her feelings about having the interpreter there. There is a rich amount of material to be covered in dealing with the client's issues about having an interpreter. Everything from her feelings about her own language to her feelings about being deaf to her level of trust will reveal itself in the discussion. As the therapist discusses these issues with the deaf client, the interpreter should be wary of his or her reactions. All the reasons deaf people have to mistrust us are the same reasons that we must present a consistent and predictable method to our interpreting, dress, and demeanor. The therapist is also trying to do this with her or his behavior. This helps us to maintain our own countertransference. Just as deaf people have set expectations about interpreters, which they will bring up with them to sessions, so do we have our own expectations and beliefs and attitudes about them that will affect our work. The interpreter should be talked about, but should never talk for herself. Interpreter participation in therapy is a serious mistake. One of the main things the therapist is working with is the client's resistance to change. It is difficult to face sometimes lifelong habits and ways of being which are destructive but nonetheless powerful forces. Clients will resist the therapist's interpretations for a long time until trust is developed or until they really feel like letting down their guard. It is no surprise, then, that deaf clients frequently use the excuse of misunderstanding the interpreter to avoid dealing with the issue. The interpreter must understand the difference between misunderstanding understandings due to avoidance and misunderstandings due to interpretation errors.